You're listening to a podcast developed and produced by the Association of Asian Pacific Community Health Organizations, AAPCHO. To learn about AAPCHO, its members, or the principles and values that have guided this organization's work for more than 20 years, please visit www.aapcho.org.
Serving locally, leading nationally is AAPCHO's latest podcast series, observing this year's theme for National Health Center Week. This series celebrates the crucial role of community health centers in providing high-quality healthcare and community development opportunities to many of the most medically underserved populations across the United States. Rea Panares most recently served as the Director of Minority Health Initiatives at Families USA and is currently a health policy and philanthropy consultant in the Bay Area. In this episode, Rea speaks with AAPCHO's Communications Assistant Beverly Quintana about how advancing the Community-Centered Health Home, or CCHH model, can help to address gaps in the current healthcare system. Rea, can you briefly summarize the Community-Centered Health Home, or CCHH, paper developed by the Prevention Institute?
Sure. The paper introduces a new model, the Community-Centered Health Home, for integrating community prevention efforts with traditional healthcare. We know that the places where people live, work, and play profoundly affect their health. People thrive when they live in safe communities, where they're able to take walks or send their kids out and play without fear, and where they're able to access grocery stores and farmers markets. Doctors and other providers know this, especially those that work at community health centers who oftentimes treat the most vulnerable in a community. We interviewed a number of these folks for the paper, and a constant frustration of theirs is knowing that they need a patient to walk more, but also knowing that their environment wasn't safe to do that and they couldn't do that. So this paper provides a roadmap and some examples of how healthcare institutions can take a more active role in making sure patients are living in healthy communities. So in addition to providing high-quality healthcare to patients and their families, the Community-Centered Health Home also looks for ways to improve health conditions, recognizing that this is just as important as prescribing medication or taking blood pressure.
Why are we now primed, more than ever, to move forward and advance this community-centered health home concept?
We're experiencing what some may call a perfect storm that make it critical for us to move forward on the concepts we present in the paper. First, we know that the current healthcare system is not working, and the Affordable Health Care Act moves us closer to fixing that. But right now, we have what many may call a sick care system, and what we need is one that truly promotes health. The current system is also not sustainable economically. Chronic diseases like heart disease, stroke, and diabetes make up more than 75% of our healthcare spending. Many of these diseases could be prevented and have direct links to how safe and healthy a community is. And lastly, there's renewed attention to prevention and public health programs. The administration just released its first ever national prevention strategy last month. There's a dedicated prevention and public health fund, and there's also overwhelming support for prevention. 73% of the public support community prevention efforts. But these conversations aren't always happening in the same space. Discussions about how to improve healthcare delivery don't often include a look at community prevention as a strategy for eventually improving health. So the Community-Centered Health Home paper attempts to bridge some of these discussions and take them out of their silos. And because there's so much momentum and hype right now about innovation, healthcare delivery, system redesign, and prevention, we think this is a perfect time to build this bridge.
What are some of the key points or findings that this paper puts forth that you feel haven't been talked about in discussions regarding the patient-centered medical home, or PCMH, and other concepts?
So the conversations about how to restructure the healthcare system that are currently taking place to make it more patient-centered or create integrated systems of care are critical and important, and we fully support these efforts. But what we're talking about in the paper and the report is slightly different from existing models. The community-centered health home model goes a step further. Healthcare institutions themselves are actively working to make change in their communities. So let me give you an example. Clinicians at St. John's in Los Angeles started noticing an increase in the number of patients that were coming in with conditions like insect and rodent bites, cockroaches in their ears, and skin diseases. All highly preventable conditions. And they knew that many of these cases were related to poor housing conditions in the surrounding community. So in addition to just treating patients, they decided to take a more upstream approach to actually try and prevent some of these conditions from happening in the first place. They started by collecting data that they needed to learn what was happening in their community and eventually make the case for change. And then they incorporated a set of questions about patients' housing conditions into office visits. They then used that data along with community partners to fight for local policy changes that forced landlords to comply with local housing requirements. As a result, they saw a drop in patients coming in with those conditions. So it's an example of how a community clinic really looked upstream at factors that were affecting its community and actively tried to make changes to improve that.
In addition, the paper speaks of other overarching system issues that should be addressed. Can you help identify one or some of the issues where you believe community health centers can more easily make the most difference and where we can see the most impact?
Sure. So one area that we think will be critical moving forward is having more champions for community prevention within the healthcare provider community specifically. And we think community health centers are natural allies in this. Community health centers have a history of organizing communities and working with and on behalf of communities. They understand the importance of community prevention. And so having more community health centers as champions within the healthcare community will only make this movement stronger in helping to really identify why community prevention should be addressed alongside quality healthcare services.
This podcast was brought to you by AAPCHO. Please join the conversation on our Facebook fan page at facebook.apcho.org and tune in for our next podcast at www.aapcho.org.